All right, guys, this is Curtis Alexander. I'm a pharmacist. In this video, I want to talk about testosterone gel. As usual, this is a viewer question that was submitted to me. So I kind of want to give you a 35,000 foot overview. We'll talk about how effective it is. Does it benefit things, how it's best used, side effects, risk factors, all those sorts of things. So let's just hop right into it. Now, first of all, testosterone gel goes by a number of different brand names. Probably familiar with Androgel. It is available generic now. But let's talk about effectiveness. Okay, so the main study that was done, they took 274 men. These men ranged in age from 18 to 80, but they all had low testosterone levels. There was a wide range in their body mass index. So, as you're probably aware, how heavy somebody is, how much fat they're carrying has a big effect on their testosterone levels. So it wasn't the best designed study in the world, but it gave us a good idea of what the gel could do for people. They started them out at 2 pumps, which is 40.5 milligrams of the testosterone gel per day. And then they adjusted that dose and looked at it over 14, 28, and 112 days. Okay. And what they found is that the men on the placebo came in at an average testosterone level of 303. 1 pump for 20.25 milligrams was 457. The 2 pumps, which is the normal dose, we'll talk about that in a second, was 524 nanograms per deciliter. And then at 60.75 was actually the highest level at 643 nanograms per deciliter. Interestingly, the highest dose did not have the highest testosterone level. 81 milligrams was 537. So it looks like 3 pumps was kind of the ideal level at 112 days. Interestingly, these men could choose to continue for a year. And what they found is that their average levels slowly declined the rest of the year. So if you're going to do that, you definitely want to keep up with your blood measurements because you may need to increase that dose as it goes along. Now, what about side effects? Okay, there's definitely side effects with testosterone gel. The most common, the one you need to be aware of, is an increase in prostate-specific antigen. We can see this in over 11% of men who take it, so be wary of that. Also, there were emotional issues. The old, like, hey, if you're going to take testosterone, you can get angry, outbursts, those sorts of things. It does happen. Not for the reason people think, and I can do that on another video, but so the emotional component, 2.6% of men and then high blood pressure occurred in just over 2%. So those are the main things to watch out for. As far as risk factors, we kind of touched on it. Any sort of prostate cancer, obviously, BPH is benign prostatic hypertrophy. That's a concern, something you want to keep an eye out for. Secondary exposure. What does that mean? It means if you apply this gel on an area of your skin that can touch somebody else, whether it's your wife or kids, what have you, they can pick that up. So we'll talk about how and where to apply it, but that's a risk factor. Blood clotting, cardiovascular risk, inguinal, what they call the bitch tits. You can get that when you apply testosterone. So that is a risk factor as well. Okay, now let's talk about dosing. How do you dose it? What's the best way to do it? There's a lot of information out there. Some of it's not so good. So what we usually do, we're going to start people normally at 2 pumps per day or 40.5 milligrams a day. And then at that half month, 14-day, and then 28-day mark, that's where we're going to adjust the dose. Everybody's going to be different. So you do want to keep up with that. Keep in mind, all right, if you want to, when you dose, because you're going to dose every day, you want to keep that away from when you shower, because if you shower, a couple of hours after you apply your dose, your blood levels are going to be lower. So try to space out when you apply and when you shower by probably 10 hours, 10, 12 hours. So if you apply in the morning, try to shower in the evening. Okay. Sunscreen, interestingly, also moisturizing lotion has been shown to increase your levels. So if you're somebody who applies that lotion and your levels come back high, that might be why. So just let your doctor know. Okay. Best results. Now, we talked about the dose. How do you apply it to get the best results? Okay. So first rule, clean, dry, intact skin. Intact means if you have a rash somewhere, don't apply it there. Okay. But clean, dry, intact. Primarily, we're looking at the upper arm, shoulder area. Okay. Surface area. This is important. You're going to apply the gel with the palm of your hand. That's what's recommended. And you don't want to do a small area. You actually want to apply it probably in that type of area. Okay. So make sure you're covering enough surface area. The other thing you'll see some people recommend to apply it to different places in your body. Don't do that. That's not what was done in studies. Not saying it couldn't work in other areas, but this is where we know we get the best results. So that means no, do not apply to your belly. Do not apply to your genitals, chest, armpits, knees, those sorts of areas. Focus on the upper arm, shoulders. Okay. Now, how are you going to get the best results? Number one, we talked about this. Your dosing's important and you need to keep up with your blood draws. Otherwise, you don't know if a dose needs to go up or down. So that 2 week to 1 month titration period is important. You're probably going to see the best results as far as your maximum blood levels around that 4 month mark. Again, I mentioned earlier, your maintenance dose. After that point, we did see the levels slowly decrease if you stay on the same dose. So you're going to need to do your follow-up labs. You may need to see your dose go up. Okay. So let me know in the comments, guys, other topics you want me to cover. Like I mentioned, this was one of them. I want to do videos that are helpful for you guys. Again, I give preference to subscribers on my email list. Make sure to grab your free checklist. That my website links in the description. Some very interesting stuff to stay away from drugs and surgery as much as possible. Things I personally use. Okay. Hope it was helpful, guys. See you in the next one.